Doctor, you're an expert in dealing with pain, certainly a big problem for a lot of people today. Break it down. Why do we feel pain? What is going on internally that sends that signal that we have pain?
Thank you so much for starting with such a simple, easy, straightforward question. We don't really know what's going on in totality. We talk about it, but most of it's theoretical, and it changes through the years. So what I'm telling you now that we think is going on is we'll have more information 5 years from now, probably 2 years from now, where we will understand. We're really only looking at part of the picture. And I guess every one of us comes to it with our own set of interests and biases, and so we kind of focus there. So when you talk to people who are interested in nerves, then pain is a nerve thing. And when you talk to people who are focused on behavior, well, it's all a behavior thing, and it's really everything. So the cells in our body communicate through a large number, but a finite number of communication molecules. And they all use the same set of communication molecules, regardless of which tissue it is. So our nerve cells and our blood cells can produce some of the same things. Most of our serotonin, which is always connected in our minds when we think about it with the brain and depression, 80% of that is actually made in the gut. So we really have to sort of think of it as a whole big gemish, big stew. And then think of different components. So pain in the periphery of the body gets sensed by these little sense organs called nociceptors, and they communicate through the nervous system. That goes up the spine. Messages go to the brain. The brain processes it in several different areas. So there's sensory areas, there's motor areas, there's emotional and memory areas that get into the act, and there's probably even more. And then it comes back down as a signal through the spinal column. And then there are things that put on the brakes on pain signals, and there are other mechanisms that we have that actually turn up the pain signals. So pain is designed, if you look at it, at what its function is in us, it's designed to keep us out of danger, to make sure we don't run on a broken leg, make sure that we get our hand off the fire. So it's an emergency signal. Chronic pain, though, isn't an emergency signal anymore, and there's not acute tissue damage going on, but the brain is still sending messages that sound and seem pretty acute, and there are a lot of reasons for that. We can probably get into some of those later on.